Good morning, everyone.
Good morning. Good morning.
And welcome to this morning's program, sponsored by the National Blood Clot Alliance. It's one of our Stop the Clot programs, and we're really delighted to have so many of you join us today. My name is Lynn Ortel. I'm a nurse here at Mass General. I've been here for a very long time, and I've also spent a very long time in the field of anticoagulation, and I've had great opportunities to collaborate with many of the wonderful speakers and experts that you'll hear today. And I've also had the great fortune to work with a great staff here at Mass General in the anti-coag clinic. I know many of you are patients here, and you've got a chance to meet many of our nurses that are here today helping out. So if you haven't, don't be shy about going and trying to find someone. If you have any questions, they're here to help you, and we'll be more than happy to do that. We have a great lineup this morning of some wonderful speakers, but before we get into today's program, I do want to extend a great big thank you to the Centers of Disease Control. They have very gratefully provided the funds to do programming such as this morning's program for patients to be able to help educate the public and increase their awareness and knowledge about blood clotting diseases and how to prevent and treat them. So we're very, very grateful for the CDC for their financial contributions to the National Blood Clot Alliance in order to allow us to do that today. You might notice that we are videotaping this morning's program. You can just ignore them, okay? They'll be quietly working in the background, and there's nothing that you need to be concerned about. So don't worry about that. If you haven't found our restrooms, if you go down the corridor heading towards the tables and chair area and keep making another left in that lobby area, and you'll find the restrooms tucked behind, like almost right behind me right here. If you have cell phones, now is the time to kindly turn them off or silence them. We'd greatly appreciate that. Hopefully, after our speakers finish their formal presentation, we'd love to have questions from you, so don't be shy about that. We'll ask the speakers to kindly repeat the questions back so we have that recorded, but don't be shy. We're here to help you, and we want to hear your questions, so any question is a good question to ask, so not to worry about that. So I think that's all I have to say, but I want to have an opportunity to introduce the new CEO of the National Blood Clot Alliance. So if you would please welcome Mr. Joe Isaacs for me.
Thank you, everyone. I feel like I'm among peers because the nature of the board of the National Blood Clot Alliance is to have people like you who have experienced blood clots serve in the majority of the membership of the board, and I'm a survivor of 2 blood clots myself post-knee surgery, so I know why you're here. I want to thank Lynn, without whose help this would not have been possible here today. Lynn Ortel and Diane Detour were the organizers of this. They helped us establish the space, get the speakers involved, and it will be a great program. In fact, Lynn alluded to the CDC. We did this program last year. They were here. Dr. Lisa Richardson, Dr. Joanne Theory, and Ms. Cindy Sears are our project officers. They were so impressed last year. They wanted us to do it again, get it videotaped so we could put it on YouTube. So you'll all be stars today, so do ask questions. You'll be repeatedly seen, hopefully, by thousands. So don't be shy. The speakers, a great group of physicians who are greatly engaged in our work, 2 of whom I believe are members of our medical and scientific advisory body. Dr. Jack Ansell, who was the immediate past chair of our what we call MASAB, that medical and scientific advisory body, is a professor of medicine from New York School of NYU School of Medicine, and he has given many of these talks, and he makes it English. I have appreciated it on the many times I've seen him, and this is probably my 3rd or 4th time, so you'll be impressed as well. Michael Jaffe, Associate Professor of Medicine at the Harvard Medical Institute, Chair of the Heart and Vascular and Stroke Care, because as you know, cardiovascular disease, AFib, big concern about vascular stroke. Andrew James comes to us from the University of Virginia, Division of Maternal and Fetal Medicine, an OBGYN, and as you may know or may not, it is the childbirth and maternal death. It's the highest reason for maternal death due to childbirth is blood clots. So it is a real concern. And Kate Cabral, who is Assistant Professor of Pharmacy Practice at Albany College of Pharmacy and Health Sciences. So we have some New Yorkers, but we also have some great folks from the Boston area and Virginia to present to you. Lastly, we're meeting, our board is meeting in town here as well, so I want to acknowledge their presence. President Kathy Smith and Vice President Tracy Wilkes-Smith, no relation. Teresa Bordeaux, our treasurer. Dr. Gary Raskob, our current chair of the Medical and Scientific Advisory Board, who is from the College of Public Health and University of Oklahoma. And board members Carol Campbell Burnett, Steve Hartley, Kay Holcomb, Maury Lieberman, and Dr. Sarah Wassner, DDS, dentist, from Michigan. Could they rise? And I don't want to stand up and let you see who our board is. Great volunteer leaders, and give them a round of applause. Well, I just want to thank the folks here at the Anticoagulation Management Services Group, the people you met when you registered, great folks who've given their time, and one of our NBCA volunteers, Caitlin Augustine, just a trooper, been at many of these events. But last but not least, you know, we have to coordinate it at our end. Somebody has to work with these folks to do it, and I want to thank Judy Elkin, who put this together and coordinated activities from our end as well. Thank you, Judy. And yes, and finally, I wish you a terrific day. I know these events are filled with learning and opportunities for interaction and sharing your own experiences. And it's important to hear your experience as well, because that's how we learn how best to serve you and your needs. So feel free to speak up. Don't hesitate to raise questions and tell us your story. So thank you so much. Have a great day.